Welcome to the 8 Minute Rule podcast, where actual physical therapists share clinical pearls designed to create conversation around what's getting results in the clinic. No fluff, no Medicare stopwatch, only quality content. Welcome back to the 8 Minute Rule. I've got Drew here with me. Mark is out, Papa Mark now, with the birth of their baby boy. So congratulations to him. But we're going to hold it down here for him in the meantime. So what we are going to be discussing today essentially is question asking. So the belief
No
that
icebreaker today?
we're going to get to the icebreaker. That comes after
Okay.
discussing the initial
Okay.
topic. Come on. Best clinicians don't have all the answers, but they have better questions. So before that, diving into the icebreaker, Drew, thank you. Let's go over what's a good holiday tradition for you. What's something that always happens around Christmas time, New Year's that you guys do in your household?
Big thing, like within my family, because not with my parents' family, not with my family. Our thing is we do a Christmas breakfast, and I'm always the one that does it. We have a traditional, it's a bacon hash quesadilla. It's a Bobby Flay recipe, and I started doing it, I don't know, probably 6 or 7 years ago, and it's become our tradition. That's our Christmas morning. We open our presents, and then we have our traditional Christmas breakfast.
Nice. Ours is we always do some gingerbread house competitions. My wife saves Halloween candy so that we don't eat all the Halloween candy. She helps the kids store away a little bit of it, break it open, and then I try and find whatever I can cement the houses together with the most, because nothing's more frustrating than those houses falling apart when you start to get candy on them. And those kids put a lot of gumdrops on the roof as well too. So, but it's always fun. It ends up looking pretty good and have a little competition with it. So, all right, so we're moving to really question asking. You know, one of the biggest skills in most providers that I think we've seen over the years to have a lot of value is being able to ask good questions. So digging into that just a little bit, let's start off here. Drew, what is one question that you are always going to ask within your subjective evaluation?
Yeah, and I'm gonna maybe take a slight detour on like a specific question and less than a specific question. It's gonna be a concept around it. So I'm always asking about what are you hoping to achieve while you're here? I guess that's the one thing that I usually ask, but it usually doesn't end there as well. Because most people are going to say, well, you know what, I want to have less pain. That's well over half of the patients who I see, like that's their first answer. But the key there is going further and saying, okay, so if you had less pain, what are the things that you would be able to do? Because, if you just change pain, yeah, that's awesome for some, but what would change about their life if they could turn that pain switch off? Typically, there's going to be some pretty powerful things because that's usually what's going to drive people to come see us anyway. And getting that information is key. I think one, to getting to know the patient and understanding why they're there, because then you can tie everything back to it, and everything that they're doing can be much more meaningful.
Yeah, I like that. Veering away from pain, obviously a big reason people are coming to see us, and we want to validate that. But the more you can get it back to function, the better. For me, go ahead.
I was say similar to that when you were talking about that concept of like the asking better questions. I think the next best question is always the thing that I'm thinking about. Like all throughout the subjective, what is the next best question? One of the biggest things I'll see with students as they have their checklist of things they want to get: clear body chart, they want to get the problem areas, quality, quantity, aggravating factors, easing factors, relationships, and they never tie it together around what does this mean. It's the same thing for goals, which what does this mean? What does it mean to the patient? Why is it important? As it is for all the other questions around why do I want to know what the symptoms feel like? Is it because I want to check this box, which isn't a great reason, or is it because I want to drive my hypotheses? And so I think when you talk about experts ask better questions, it's because they have a goal in mind of what am I trying to get with this information? And they're not going to stop by just checking the box as well. I think that's a key piece to it of knowing why are you asking this question and then going further every time it's needed.
Yeah, I think that's good. You want to get a lot of information out of questions without, necessarily pushing them down a rabbit hole to get you so much information. You're trying to solve too many problems at one time. So
Yeah.
absolutely. One
I'm
of the things
sorry
I
I
was thinking
interrupted
of.
you.
No, it's good. For me, it's not going to be with everybody, because this doesn't apply very well to a post-op patient. But it's a question I really enjoy, which is one that is not asked by many providers, and it's why do you think you're not getting better? I think what's cool about that is there's not, you can guarantee that almost nobody else has asked the patient that. And you kind of give them some autonomy over being able to give you an idea of what it is they think's going on. And I think that enables me to know which direction that I need to focus. Are we dealing with somebody that is very structurally focused? This muscle, bone, joint, ligament, tendon is my problem versus, I don't know, I hadn't been getting a lot of sleep lately, stress, whatever have you. And so I think it just helps angle my treatment a little bit better when I'm able to kind of break into their head. Now they also feel like they're a part of getting the solution here, which I think is a fun one to do. But again, it's not going to apply to every situation. However, I do think it's a really useful question to get some good information out of.
Do you use that a lot at the initial eval, or is it often if someone's not making the progress that they expected, or if they're frustrated around their maybe lack of progress?
Yeah, it's a great question. To me, I want this at the eval, because, and maybe this is an ego issue to some degree, but if I'm asking it when they're stuck, I feel like it can be construed to some degree as like, all right, this guy doesn't know what he's doing, so now he's asking.
Yeah.
Which again, I think you can still do that well, without an ego situation, but I think there's a ton of value to me after we've kind of gone through the subjective and the patient is recognizing that, hey, maybe they've done several things to try and get their problem better. And so I really want to get into their mind there at the end and get a good, clear picture of why it is they think that they're not better at the moment. And then we can be able to attack on that. So, but I see a lot more value of that in the eval than I do further on.
Yeah. I like that because that opens up a lot of the opportunity to have the patient help determine their path, like with the motivational interviewing and the research around it. If they come up with their own plan, they're significantly more likely to follow it. And there's a lot of times that patients, they know some of the things that they need to do. And if we just tell them, the chances of them really doing it versus them coming up with on their own. And that's where you can ask questions of, okay, like you said, if it's been stress or exercise or weight loss or things like that, you can follow up that. Yeah, you know what? I think that's really good. What are some ideas that you have in order to do that and get there?
Yeah, I love it. Or educating them and trying to give them a framework and a plan, right? One of the best things that we can do. Piggybacking off of that, the patient gets stuck. I know it doesn't happen much for you, Drew, but occasionally it will. And you've got a great plan going. The patient's just not responding. What kind of questions are you asking at this moment to try and get them unstuck or get things going in the right direction?
Well, I think the first and foremost is looking at what are the things outside of this that are happening, that are going on. This meaning the sessions while we're here, because we can talk about all the things and do lots of the right things, targeting the right tissues and try to work on loading. But there can be a lot of things that are occurring outside that either happening or aren't happening that can affect it. So things like lifestyle things, lack of sleep, stress, fears, anxieties. Is there something that I've missed maybe outside of it? Or how are I'll ask this almost every time, is how are your exercises going? And a lot of times it's the ones that, well, I did them a little bit. Okay. And in those scenarios, I'm probably trying to look at motivation and are they following the plan first of all. So that's one of the first things that I probably want to know is the plan that we have in place and on my mindset and the track we're going down. Are we actually doing this before I look at something? Did I miss? Right. So that's another thing of I'm maybe asking myself, did I miss something here? But before that, I want to know, are we actually executing the plan that I had in mind? And maybe I didn't explain that very well, or maybe they didn't understand it well, or life happened and, it does happen and that's okay. But if something's not going as I planned and I'm, thought that I had a pretty good plan initially, what are the things that are influencing that? Is it because I maybe had the wrong plan and I need to look further down that road? Or is it because it's just not going as I planned and I might not be realizing that?
Yeah, that's really good. And we do see this a lot because to your point, hopefully we're able to check as they're coming in each visit, but we're still relying on them to have honest communication. Sometimes it's hard to get that bigger picture view of things. Again, if it's a true strength issue, it's gonna take some time. But again, I think having that good conversation is important, and it's hard because I think even the most confident clinician, there's this kind of itch in your heart. Like all of us want our patients to get better, right? There's nothing more frustrating than when your patient's not getting better, and the patient feels that, and they can sense that from you too. And so, sometimes you got to take a step back and make sure that your conversation is not making it aggressively point to that, hey, the patient is the problem, even if they actually may be doing some things that are the problem. And what I really try to do is kind of communicate with them that I want to come beside you. Like let's figure this out. Again, I had a plan, as you said. First off, were you following it? And if you are, great. So we need to get back to the drawing board a little bit, but let's make sure that we look at what you're doing outside of here, because inevitably, if you give the body the right environment, it should heal itself. And so right now, it's not getting that environment. So let's really break down and see what it is to make a change on it. And I think most times when you involve the patient in on it, again, give them some autonomy, you're going to see that it takes down a lot of those barriers that can exist that can really just kind of make it a more tense conversation. I think that's really important as well too.
Yeah.
So
I think that question that you posed of like, why do you think you're not getting better, could be good depending upon the type of relationship that you have with that patient. If they know that you are really invested and you're working, and I mean, you might say, I really want you to get better. I want to make sure I'm not missing anything. Do you think there's anything that I'm not saying that may be helpful? And like being that vulnerable part of like, I know that there's things that can be missed. I think that could open up the potential for them not to view it as, well, I should know everything. What do you think? Or maybe I don't know everything, but sometimes that's okay. Like to say, I'm never going to know everything all the time. There's probably things that I miss. I see you twice a week, and yeah, we have great conversations. I want to know you know yourself as good as anyone. Why do you think you're not getting better? I think that could
I
be
think
done really
that's
well, and I really like that. I might have to try it.
yeah, I think that's really good. It's the question that you ask when the energy's low, right? That if that energy's high, I don't think
Yeah.
that's the one that you want to be bringing out there at the time, because it's just not going to go off well. But, to your point, I think you can ask it really well. That proves to them that you guys are on the same team trying to figure it out. Real quick before we close, I know we're running a little bit over time. Drew, I want you to share your Take Five concept about getting to know a patient well, and it kind of fits to me in the question asking. So the idea, obviously, we want to get to know our patients, but we also don't want to pry into their individual space. So what are some strategies that you have used in your clinic with getting your clinicians to know their patients well?
Yeah. So this was something that I think I stole from Larry Benz, listening to him on a podcast one time and talking about the relationship with your patients. And it's the idea that all of my staff, my techs, my PTs, I call it the Take Five rule, where if I walk up to you at any point, whether you're with a patient or afterwards, I wouldn't do this like in front of a patient directly, but when they were done working with them, I would say, hey, give me five about that patient. So I want to know that they are invested in communicating and getting to know the patients and developing those relationships as well. So it is, I want to know five things about them. It might be that, they have two dogs and these are their names. And they like to take them for walks. Whatever their job may be or hobbies, they were in this vacation last week, or they have grandkids that are this name, or things like that, where it one builds the relationship with them. You get to know them, and it makes the community within the clinic a lot better. But then that can also help drive a lot of the care as well. The more you know about them, the more you can tailor things to what their specific needs are.
Yeah, good stuff. I love it, man. I gotta get that going in our clinics as well too. I think that's a really good use. And again, when you know patients and they know that you care, that's a big deal.
Yeah.
All right, Drew. Appreciate the time. Everybody else, keep asking good questions out there. Till next week.